my name is Marka McCauley, and I'm on the board of Sage Home. And for those of you that are unfamiliar with Sage Home aims to be a residential recovery center where women struggling with addiction can get treatment with their children as an alternative to child removal. Sage Home has several partners, and throughout the course of the next few months, we're going to start introducing not just our partners, but different people in the community that have a stake in Sage Home. Our very first guest is Dr. Emery Eaves. She has a PhD in medical anthropology, and she is a professor at NAU. She has done a lot of collaborative research on interdisciplinary health, and her particular research focus is addiction, particularly with opioid use during pregnancy. Hello, Dr. Eaves. How are you today?
I'm well. How are you?
I'm doing pretty well. My first question for you is, can you explain a little bit about what health equity is?
Yeah, so to explain health equity, I'll start with talking a little bit about the social determinants of health, because it's kind of where we start with thinking about health equity. So the social determinants of health are defined by the World Health Organization briefly as the conditions in which people are born, grow, live, work, and age. So really encompassing of lots of different situations that people can live in, and not just access to healthcare, but kind of all the factors that might go into people's health. So their environment, the kinds of places that they have to recreate, their interactions with healthcare providers, and all these kind of different pieces. These circumstances are shaped by distributions of money, power, and resources at global levels, at national levels, and at local levels. So there's all these different kind of areas that we're looking into for how health is impacted. And the social determinants are what we look at as mostly responsible for creating health inequity, so unfair and avoidable differences in health status that we see within and between countries and even in local communities. So going from there, then equity, health equity, we would define as the absence of avoidable, unfair, or remediable differences among groups of people. So whether those groups are defined socially, economically, demographically, or geographically, or by other means of difference, so however people are grouped, health equity or equity in health implies that ideally everyone should have a fair opportunity to attain their full health potential. So no one should be disadvantaged from having this potential. So equity is different from equality, because equality is defined as everybody has equal access to things. And equity means that everybody has what they need to be able to reach that full potential. So some people would get more because they have more disadvantages or more kind of hurdles to overcome. And that's what we mean by health equity.
Awesome, that was great. And just stemming from that, just moving a little bit further with that, how would you see health equity impacting a population that would be utilizing services for Sage Home? As far as the addiction community, especially mothers with addiction that have children or are pregnant?
There are lots of ways for this particular population that health equity is a big issue. So when we think about health equity, we're thinking about not just access to healthcare, like I said, but even things like having a social network and feeling of support, and even a sense of love or belonging in a particular social community, feeling valued, having a community network that you can rely on. Along with lots of other factors like sanitation and environment and jobs and housing and what kind of a neighborhood you live in and what your kids have access to and all those kinds of factors. So for women in substance use recovery, one of the big things that we're interested in is stigma. Women that we talk to in this community talk a lot about stigma and not wanting to go in and talk to a doctor who's not going to treat them very kindly, or not wanting to share their problems with peers when they feel like they are at risk of being judged. In this community also, a lot of people have histories of housing insecurity, childhood trauma, histories of interpersonal violence, and all these kind of intertwine as factors that lead into and also perpetuate cycles of substance abuse, and then lead back into stigma and a sense of social exclusion and powerlessness. So to achieve equity then for these moms and these families, there's lots of additional supports that are needed to counter all the areas where they face disadvantages that make it hard to break out of these cycles. So a lot of times when we talk about addiction or substance use, you'll hear people say, well, they should just stop. But health equity really is looking at taking into account there's so much more to substance use recovery than just stopping using a substance. Even if you've stopped using a substance, do you still face a lot of stigma when you seek care for yourself or your child? And does that prevent you from getting good care for your child, whether you're using a substance anymore or not? And then is substance use a coping mechanism that you need help to address lots of other areas to be able to kind of get out of a pattern that you've been in for a long time? So thinking about taking into account all these different factors to achieve health equity and then giving those additional supports to be able to break out of those cycles is how I would explain that.
Right. So looking at the bigger picture, that there's more than just addiction happening here with these families that are struggling. And if there's a way to take some of those barriers away, like you mentioned, the housing insecurity and child separation and removal, so all the hurdles you have to jump through, BCS involvement, food, nutrition, community, all the things that tend to be wrapped up in addiction and the struggles that these families are going into. Health equity gives more support because their health disparities in a way are greater. Does that sound about right?
Yeah, exactly. Yeah, so by Sage Home's idea to give people a place where they have housing, but they can also feel like they're secure, where they're not questioned about whether they're providing a secure home life, where they get access to treatment, access to care, access to services in a situation where they could even ask a peer, what do you think about this provider? Are they going to be nice to me if I go in there? Should I actually go? And the person says, yes, I think that person will treat you well. So they go in feeling a sense of confidence that they can even seek care for something.
Right. So even the safety and just being able to tell the truth without stigma, in a sense, silencing them.
Yeah.
Yeah, well, that's an excellent description, and I really appreciate you explaining that, because sometimes these concepts are really hard to really understand and dive into. So Sage Home is partnered with the Center for Health Equity at Northern Arizona University, and Dr. Emery Eaves is one of the main contributors to that. And the way that our partnership looks is collaborating with research and collaborating with these ideas of health equity. So Dr. Eaves, thank you so much for joining us and being our very first interview that we do on Sage Home.
Thank you for having me, and I'm excited about our continuing collaboration with Sage Home. I think it's a really important addition to the community.
Awesome. Thank you so much, and I will see you around as soon as, lockdown stops. All right, bye.
Bye.